Below is a detailed comparison of Hartnup disease and Wilson's disease, highlighting their 15 major differences in terms of definition, cause, clinical features, diagnosis, treatment, and more. Chapter 1. Definition. Hartnup disease is a rare autosomal recessive metabolic disorder caused by defective transport of neutral amino acids, particularly tryptophan, in the intestines and renal tubules. Wilson's disease is a genetic disorder of copper metabolism, leading to toxic copper accumulation in organs such as the liver, brain, kidneys, and eyes. 2. Cause. Hartnup disease is caused by mutations in the SLC6A19 gene, which encodes a sodium-dependent transporter involved in the absorption of neutral amino acids across epithelial cells. Wilson's disease is caused by mutations in the ATP7B gene, which encodes a copper-transporting ATPase involved in the excretion of copper into bile and incorporation into ceruloplasmin. 3. Mode of inheritance. Both disorders are inherited in an autosomal recessive manner, requiring 2 copies of the defective gene, one from each parent, for disease manifestation. 4. Pathophysiology. In Hartnup disease, the defective transporter results in malabsorption and renal loss of neutral amino acids, particularly tryptophan, which is a precursor to niacin, vitamin B3. This leads to secondary niacin deficiency. In Wilson's disease, the defect in ATP7B protein leads to impaired incorporation of copper into ceruloplasmin and reduced biliary copper excretion, causing toxic copper accumulation in tissues. 5. Main biochemical abnormality. Hartnup disease leads to low levels of tryptophan and other neutral amino acids, contributing to a niacin deficiency. Wilson's disease results in elevated free copper levels and low serum ceruloplasmin. 6. Primary affected systems. Hartnup disease primarily affects the renal and gastrointestinal systems, with neurological and dermatological manifestations secondary to niacin deficiency. Wilson's disease affects the hepatic, liver, neurological, and ocular systems. 7. Neurological symptoms. In Hartnup disease, symptoms may include ataxia, tremors, nystagmus, and psychiatric disturbances, e.g., irritability, depression, due to niacin deficiency. In Wilson's disease, basal ganglia damage causes tremors, dystonia, rigidity, dysarthria, and cognitive decline. 8. Dermatological features. Hartnup disease presents with pellagra-like skin rashes, red, scaly eruptions typically seen in sun-exposed areas. This is due to niacin deficiency. Wilson's disease may present with jaundice and skin hyperpigmentation, but not the pellagra-like rash seen in Hartnup. 9. Ocular manifestations. Hartnup disease does not affect the eyes directly. Wilson's disease is associated with Kayser-Fleischer rings, brownish or greenish rings around the cornea, visible with slit lamp examination due to copper deposition in Descemet's membrane. 10. Urinary findings. In Hartnup disease, urinary amino acid analysis reveals elevated levels of neutral amino acids, especially tryptophan. In Wilson's disease, 24-hour urinary copper excretion is elevated, often used as a diagnostic tool. 11. Blood tests. Hartnup disease may show signs of vitamin B3, niacin deficiency, but specific amino acid profiling is diagnostic. Wilson's disease typically shows low serum ceruloplasmin, elevated liver enzymes, and increased free copper in the blood. 12. Age of onset. Hartnup disease usually presents in infancy or early childhood with intermittent episodes of symptoms. Wilson's disease typically presents in late childhood to young adulthood, though it can vary. 13. Diagnosis. Hartnup disease is diagnosed by urine amino acid chromatography, showing neutral amino aciduria. Genetic testing can confirm SLC6A19 mutations. Wilson's disease is diagnosed through a combination of low serum ceruloplasmin, high urinary copper, liver biopsy, and genetic testing for ATP7B mutations. 14. Treatment. Hartnup disease is treated with a high-protein diet and niacin nicotinamide supplementation. Sun protection may help reduce skin lesions. Wilson's disease is treated with chelating agents like penicillamine or trientine, zinc salts to block copper absorption, and in advanced cases, liver transplantation. 15. Prognosis. Hartnup disease has a generally favorable prognosis with dietary management, and many individuals are asymptomatic between episodes. Wilson's disease can be life-threatening if untreated, leading to liver failure, neurological damage, or death. However, with early diagnosis and lifelong treatment, patients can live normal lives. Thank you. Have a nice day.